Hi, and welcome to the Joanna Briggs Institute Evidence Synthesis podcast. I am Vanessa Martinez. I am honored to share my thoughts and commentary with you today. I am a doctorally prepared nurse with over 26 years of nursing experience, focusing on adult critical care and leadership. I have a strong commitment to reinforce helping and trusting relationships between our fellow caregivers and our patients and their families. I am currently the Director for Virtual Nursing Care. I am responsible for the region-wide direction, planning, and coordination of the virtual nursing programs and practices across 21 medical centers in Northern California. Before I begin, I wanted to thank JBI for the opportunity and to acknowledge Dr. Elizabeth Scruth, my esteemed colleagues Bronwyn Cox and Maria Galeto for their mentorship, guidance, and support in creating this podcast. I will be discussing the manuscript by Julian Derry and colleagues entitled Barriers and Facilitators for Implementation of a Patient Prioritization Tool in Rehabilitation Settings. The study's overarching purpose was to improve access to care of patients waiting for elective services by prioritizing those who needed urgent care by developing a web-based patient prioritization tool. A prioritization tool helps the clinician triage who should receive care first and allocate services when the demand exceeds the supply. Deary and colleagues recognize the importance of implementing a patient prioritization tool in a rehabilitation setting to manage the waiting list according to determined criteria equitably. They identified the advantages and challenges of implementing the tool at two rehabilitation programs at the Integrated University Health and Social Services of Capitale Nationale in Quebec, Canada. The team conducted a mixed method study design to recognize the facilitators and barriers to implementing a patient prioritization tool. They used questionnaires and focus groups among service providers from two rehabilitation programs, in driving evaluation program and compression garment manufacturing program for burn victims. Both programs receive significant referrals and have to manage the waiting list due to different criteria to prioritize. The study was based on a conceptual framework that influenced the assessment, implementation, and evaluation context in their proposed patient prioritization tool. The different concepts were used as implementation and evaluation criteria in three different ways. First, to raise awareness for possible influential factors. Second, to assist in the analysis of critical processes and outcomes. And third, determine all the findings in the implementation process to explain the results and understand what worked and why. The study results supported using an innovative tool when influenced by the organizational readiness to change, individual, and the tool characteristics. Overall, the participants considered the tool beneficial to the stakeholders and clinicians. The integration of the tool will be successful if there are organizational readiness and involvement of all the stakeholders in the implementation and change process. The participants also expressed that the tool needs to be simple and easy to use, and adaptable for the clinicians to help them make an effective decision in triaging who will need urgent rehabilitation services. It is essential to note the clinicians' positive responses to the benefits of having a patient prioritization tool. It helped increase their work efficiency, patient reassurance, and equitable method of prioritizing the patients. In contrast, the identified barriers to change were staffing issues, time pressure, lack of space and equipment, and organizational constraints. Exploring the determinants and obstacles in implementing the tool will guide the team in reaching agreements to identified constraints. However, the study results should be interpreted in caution due to the mixed method study design that limited the measurement and analysis of their data on how the questionnaires and focus group process inform each other. Also, conducting the study on two rehabilitation programs can pose a challenge in the measurement and evaluation brought by the individual raters' possible biases, which can also influence the achievement of high reliability. Furthermore, the study did not describe how they used the two questionnaires' determinants in developing the patient prioritization tool. Implementation of this project in other settings could be enhanced by further description of the questionnaires used to develop the patient prioritization tool. Additionally, inclusion of the actual tool could help other rehabilitation centers in future research studies. As the regional leader, I am responsible for coordinating a sophisticated and unique clinical early warning system that transforms care within the inpatient setting. We also develop a tool to improve the efficiency of reviewing patients' clinical changes and managing the alerts to improve patient outcomes. I commend the author's objective in developing a tool where patients are assessed based on this selection criteria to help in the decision-making process that generates the priority scores and determine which patients require urgent care. Thank you so much for listening. In closing, thank you to our authors for their passion for providing exceptional care without delay. They highlighted the need to develop an innovative tool in improving patient outcomes in a rehabilitation setting.